welcome back to my YouTube channel. My name is Ioana and I am an interpreter. And today, once again, I am creating interpreting practice video. This video is a medical interpreting practice for a consecutive interpreting. Before I start, if you like to join my member button, you can do so. For $3.99, you're going to receive a weekly medical vocabulary drill with me exercise. Once a month, I'm gonna answer your questions by video or by live. And for $7.99, you're gonna receive a full access to my interpreting live, my interviews, what I experience, what kind of situation I encounter on a daily basis. You're gonna see the newest things that I find about interpreting, medical interpreter field, and so on. Said that, we are going to start our recording. This is gonna be a medical interpreting pharmaceutical call, consecutive. So there would be in English only. I will read the script. I will pause where you can interpret and continue for the entire call. Let's start. So I could see allergies to medicine. The medicine is called astatine. Is that a medicine that relax your muscles? Yes, yes, I have allergy to this medicine. Oh, is there, okay. Is there any other allergies besides this one? Yes, that's correct. Other allergies I don't have, just this one. And who is your primary care physicians right now? Oh, it's Maria Gonzalez and Tatiana James, those two doctors. Okay, I can see that. So Maria's Gonzalez, it's located in Brooklyn, Western 10th at the Brighton Avenue. Is that correct? Yes, yes, that's correct. Okay, thank you. Now we're going to discuss your medicine and how are you taking your medicines. If you need a minute to go and take all your medicines, please go ahead. We're going to wait. We're going to discuss which medicine for what problem are you taking and how do you take it, okay? Oh, okay. I already have all of my medicines in front of me. I'm ready to start. They're all here. Okay. Are you taking magnesium 400 milligrams? This is a supplement. Yes, I take one pill a day. Okay. And the next one is called calciferol, 1.25 milligrams. Do you take this one? Oh, is that the vitamin D, madam? Yes, this is the vitamin D. Oh, yes, I take vitamin D, one pill a week. All right. And do you take aspirin 81 milligrams for your heart? Yes, I take it every day. I want to let you know that I also have fluconazole and paracentrol. All those medicines I do take. All right, that's great. Uh, do you take alloprama, like a bismol? It's called, interpreter is called allopritamol. The simple name is bismol. Do you take this one? Oh, this is called allopritamol. Yes, I do take this one for my gout disease. Yes. Is that once a day when you need it, or how do you take it? Yes, when I have pain, I take it. Oh, okay. The next one is called acetaminophen, or the simple name of a Tylenol, 500 milligrams, is a painkiller. Do you take it? Oh, this one is for the headache. I have still some left, but I don't think that the doctor prescribed this to me anymore. But I have few pills left. This is for a severe headache. Oh, are you taking this twice a day when you need it? Is that how you use that medicine? Yes, yes. And I take one more painkiller. It's called diclofenac, if I'm not mistaken. It's something like a cream, I believe. I know it's because I have arthritis. When my hands or bone hurts me, I use it. It's called diclofenac. I put it like a cream, and then the pain is going away. So are you taking it twice a day as needed? Yes, this is very good. I really love this medicine. Thank you so much. Okay, the next one is for depression. It's called fluoxetine 20 milligrams. Do you take this one? Yes, once a day. What about Repat one time a month? How do you take this one? Yes, 450 milligrams one time a month. And what about Vespa? Do you take SIPA? It's a pills for cholesterol. No. Do you mean Vesepa? I take Vesepa. Yes, yes. So do you take it twice a day? Yes, I take it twice a day. And do you take for diabetes Tragenta 5 milligrams? Yes, I take Tragenta 5 milligrams once a day, and I have a second one twice a day, 500 millimeters, Kylam and Kipetitiet. Those three medicine I take for diabetes. Okay, so do you take glyphosate 10 milligrams, 2 pills, one time a day? Do you take this one? Yes, one time a day. What about Gardains or Guardians, 25 milligrams? Oh, yes, Gardains, one time a day, 25 milligrams. Yes, I used to take 10 milligrams, but she increased it to 25 because my sugar was higher. Okay, all right. I also take Adarbicor 20/25, tenclamidine 20/37 ml, and enclanidine. This is pills 01 at night. I have another clanidine that I take is patches, and I use one patch one time a week. Oh, all right. So I understand the clonidine patch you take at night. And what about Nebadil 2 times a day for your heart? Do you take this one? Yes, I take 2 pills, and then I also take metoprolol as well, 100 milligrams. All right. And is that once a day? Yes, yes. All right. And are you still taking the furosemide 40 milligrams, the diuretic medicine? Oh, yes, furosemide. Yes, I take it. What about Creon, like Lycase or something like that? This is a pills. Do you take those? Oh, Creon. Yes, yes, Creon. I take one pill after I eat. So so you take Creon 3 times a day to help you with your pancreas, is that correct? Yes, yes. After I eat, it is a very good medicine. I take it. Oh, very nice. And are there any other medicine that you take, but we didn't talk about it? Whatever we talk, that's it. I don't take anything additional. Oh, all right. So we're going to send you a letter in the mail that will have everything we discussed today. All your medicine list for your own record, or to give it to your doctor when you have an appointment. Please, it is very important that you don't stop your medicine and you do not start a new medicine without a doctor referral or prescription. Oh, I understand. I know how important is that. I worked 32 years in the pharmacy. I was preparing the medicines for 32 years. I know that. Oh, that's so wonderful. I just wanted to let you know that your medicine, allopurinol, it's adjusted on the base of your kidney function. That if your kidney works well, the dose of this medicine, it's less. And if it's working worse, they increase the dose. Are you aware of that? Oh, yes, yes, I know, ma'am. I am aware. But right now, I'm not taking this medicine. You know, they measure my kidney function with a blood test and also a urine test. And they monitor me very closely. And in the base of my condition, they decide if I'm gonna take the medicine or not. Okay, that's correct, ma'am. That completes our call for today. Do you have any questions for me today? No, thank you very much. Thank you for calling me and thank you for your attention. And that was everything, guys, for our pharmaceutical call for today. I hope you did exercise your note taking and your consecutive things, consecutive interpreting practice. I want to let you know that some of you guys commented that the pronunciation of some of these medicines or word is not clear. I know, I'm aware of this, and this is not an accident most of the times. You have to practice realistically and understand that you're not gonna always have a crystal clear sound on your VRI or OPI, even if you're in person. You're not always gonna understand, for example, allopurinol. It's a medicine. So I read it very slowly for you. It's one of the last medicine, allopurinol. Nobody's gonna read it as like clear as that and break it down for you. There are many medicines that you're gonna have hard time to even pronounce because they come from Latin and Greek, and they're a mixture of substances that are chemical substances that it's hard to pronounce. So I know that these medicines, a lot of them are not something that you pronounce on daily basis. That's actually a real call that I did. I took the private information off and I create this practice for you. This is as real as it can get. You're not going to be able to understand the name of all the medicines and you're not going to be able to pronounce it properly. So if I can give you a tip here after this very sweaty practice is what I do, knowing and being aware that I'm not going to be able to eventually pronounce it as perfectly because you hear the word one time, is a new word, you don't know exactly what this medicine is. Of course, I'm not talking about furosemide or metoprolol because you do work with those medicine quite often. But some of them, like most of the people will use Tylenol instead of acetaminophen, which is exactly the same meaning for the medicine, but it's just in a chemical way. But you're gonna have those calls that you're gonna have acetaminophen, 500 milligrams for pain, and you will just have to try to repeat the word as close as how you hear it. This is what I do. I do try to pronounce the word as closely as I hear it. And there is not always 100% success in this trick, but I will tell you that rarely I have complaints about pronunciation of the medicines. As long as you pronounce it as close as you can hear it. On the other side, there is understanding. As you can see, this is something that I do and something that I suggest you to do. I will tell you that there is medicine that you're gonna use on daily basis and that you're gonna pronounce and you're gonna learn how they're written in Latin. Like, for example, furosemide. Furosemide is a diuretic medicine that people take when they have, I'm just gonna tell you, so much times I use furosemide that I can tell you even what it's used for. So furosemide is a urinary pill that people normally take in the mornings that help them urinate. It actually makes them urinate a lot. And usually people that have a heart disease, they are taking this medicine because their feet or extremities get swell or swallow, and these pills help them to urinate or to throw out the excessive liquids that they accumulate in their body. These excessive liquids usually are accumulated when the heart is not working properly. So this medicine is something that you're gonna hear a lot. You're gonna know, like I know, what is that medicine for. Guardians or gardaus or gardens, whatever you want to pronounce this medicine like. This is another one that I heard quite a lot in my sessions. Let me see. Diclofenac as well. Fluoxetine is common for depression, classical. Of course, you know aspirin. Normally for the vitamins, they don't use the, like this provider use calciferol. Normally they say vitamin D, vitamin B, or so on. I don't know. She decided to use the medicine, the chemical name of the medicine. And the medicine Astatun, I never heard this medicine. I know it's a medicine. I just try to repeat it as close to what she said. Said that another things, there is some passages here. This call was technical because of difficulty to pronounce the medicine, but I will tell you, for me, it was quite a normal call. This type of calls I do quite a lot. The only difficulty was the longest passages here out of the terminology and writing how many times a day the pills are, once a day, twice a day, or you had some medical terminology like pancreas, kidneys, blood pressure, your kidney function, and so on and so on. I do hope that you guys have fun practicing your consecutive interpretation here. I hope you enjoyed this video. If it was useful, do press like. This is how you can support me, or write a comment about what kind of consecutive practice you would like me to do for you. I do a lot of them every day for many hours a day. I don't think I have done the emergency department or ICU practice yet. I'm starting to get more comfortable with this. I do provide quite a lot of those lately. Said that, I hope you enjoy it and have a good day. Bye-bye.